Hey, everybody, Dr. Rob Silverman here. Hope you all had a great weekend. I was down in Florida lecturing at the Florida Chiropractic Association, the biggest get-together of chiropractors during the year. A lot of exciting things to cover. A lot of people ask me about supplemental use, and has supplemental use increased during the pandemic? And surprisingly enough, it truly has. So some of the big questions are how much, what kind of supplements, and what do you look for in supplements? And these are great questions. The quality, the integrity, but what are those numbers? So let me share with you some of these numbers. 3 in 10 Americans increased their supplemental use during the pandemic. Actually, 29% of Americans taking supplements today more than they were taking before the coronavirus came to the market, if you will. U.S. supplement takers now, 76% of Americans take supplements. So 3/4 of Americans take some form of supplements. Where do you get them from? What do you look for? And really, who do you trust for the supplements? 2/3 of those who increased supplement use cited the desire to enhance overall immunity, no surprise, or protection from COVID-19. And obviously, there was a part of time where there was no vaccine. There's supplements in reference to the vaccine to support it and overall health after. And I think one of the things that really speaks loudly is that whether you're vaccinated or not vaccinated, whatever you're doing, you've got to take care of your immune system. You've got to take care of your health, because immunity now is at the top of everybody's consciousness. And health and immunity, without question, go hand in hand. I've always said that my mantra is to manage and modulate inflammation. If you can do that correctly, you can have a good outcome in your health interests. However, it's been brought up to me that maybe the imbalance in the immune system leads you down a path of increased inflammation. So I may have to take that as a practitioner one step further and look at the immunity. So I'm going to talk about the supplements, and I'm going to tell you which supplements are really good for immunity. Some of the other reasons that people cited in this survey were that they wanted to take health into their own hands, which is great that they want to make health a part of their life, and they want to make health and realize that health is wealth. But to take it in their own hands and not look for practitioners, chiropractors, functional medicine practitioners is a little disconcerting. In addition, they want to improve their sleep, and they want to improve their mental health. We're seeing a lot of mental health issues in the last 18 months with this advent of COVID-19. Interestingly enough, I can relate to all that because I see all the people stressing out because of the lack of COVID-19. So was having a little technical difficulty. I thought I lost you, but you're there. No worries. 52% of Americans believe dietary supplements are available were deemed safe and effective by the FDA. Well, that's great, that 52%. That's obviously a majority. It's not a high enough majority. However, the FDA doesn't regulate supplements. And that's some of the interesting things. So that even more so, it's incumbent on you as the individual, but more incumbent on you, the individual, to seek out, I like to say someone like myself and my colleagues, really to seek it out so you can find out who's got the good stuff, who's got the ingredients. Where does a company get their ingredients from? How is it formulated? Is it a capsule? Is it delayed release? Is it instant release? Is it time release? What is it emulsified in, if it uses an emulsifier? All these things. What do they have to put on the label? What's on the label? The key to the companies, I always start with, my first question is, what's on the labels in the bottle? If it's what's on the label, it's in a bottle, it's a good starting point. Then I ask people, where did you get it? Show me some proof. Show me what we call some assays. So show me some assays where you got that ingredients from. Then let me look at the formula. Let me see how the formula molds and melds. And then we look at the dosage of the ingredients. Is it a subdose? Is it not enough? Hey, it's supposed to have vitamin D. It's 500 IUs. It's not enough. We know we need 5,000. But is it also 35,000, which for me is a lot at one dosage? Again, so I look at all these things, a lot of my colleagues and practitioners. So if you're interested, reach out to me. I will give you a list of companies that I recommend that I use in my office here today. 32% of Americans believe if the supplement could be dangerous, it would not be allowed to be sold in the U.S. Well, that's only a third, and that may not necessarily be correct. I'm not saying that they're dangerous. I'm just saying you really, once again, need to seek out somebody who understands what's in the label. What's in the bottle is in the label, the ingredients, the dosage, and the formulation, and if they used it. I mean, if they use it on themselves. So for me, I have a patient base. I have a colleague base. I lecture. So we get this feedback, and we sit in a proverbial Zoom room and talk about it. So those are things you may want to look for. 47% consulted with a healthcare practitioner before use. Now, love my medical doctor brethren. Got a lot of referrals from them, work with them hand in hand. By their own admission, if they haven't done any work post medical school, they maybe get up to 3 weeks of nutrition. Certainly supplements was not included. A lot of doctors have done advanced training. Please look for the healthcare practitioner that has advanced training in nutrition, in clinical nutrition, in functional nutrition, in functional medicine. Another stat I want to share with you is 46% currently take prescription medication, have not discussed with their doctor the potential interactions with the supplements. So what I look at it is, it's a great question. Many people here, America is a drug haven. A lot of Americans take drugs. Does the supplement contradict or counteract or interact inappropriately with the drug? Great question. Well, for instance, can't take grapefruit with statins, a whole bunch of things like that. That's something that, you should sit down. It's just not so easy. And well, I'm going to go on the label, on the aisle, pick something up and start taking it. It's not like buying a piece of chicken. It's not like buying a piece of turkey. You're putting something in your mouth. So again, my suggestion is to seek out someone who has a little bit more advanced training and is looking to help you, because the idea of a supplement is not as just a treatment. It's supplemental to what? It's supplemental to lifestyle. Lifestyle includes diet, mindset, exercise, and the supplements. So you want somebody to really look and personalize and individualize what you take for you. 81% of Americans feel comfortable sharing with supplements they take with their doctor. So that's great. Out of 10, 41% taking supplements, it hasn't occurred to them to discuss it with their doctor. 35% say their healthcare practitioner isn't interested in their supplements. That may be true. I am most certainly interested. 32% don't think their healthcare practitioner knows enough about supplements to advise them. Well, if that's the case, find somebody who is, and or ask your healthcare practitioner if they do. So the big question is, which immune supplements would you recommend? Now, for me, I earlier stated that the balance in your immune system is your critical element. Your balance between the two legs of your immune system, your innate and your adaptive immune system. Your innate is everybody has, they have it from birth. That innate immune system is what I call your Marines. They're your neutrophils. They're your white blood cells. They come in and destroy everything. So with that being said, in that destruction, they're your generalized immune system. You need that in balance and timing with what we call your adaptive or your acquired immune system. You acquire this as you age. Teenagers begin to get an acquired and adaptive immune system. It's adaptive because it's very versatile. The problem with the adaptive is that if it doesn't function well, it leads you down a path of what we call increased inflammation and actually autoimmunity. So there's two parts of your adaptive acquired immune cells. They're B and T cells. The T cells come from your thymus. When you're 70 years old, in theory, your thymus no longer is functioning if you haven't been on a health path. Your B cells come from your bone marrow. They make your antibodies. So your T cells recognize what's going on. Your B cells memorize. That's what antibodies make. Antibodies, IgA, IgG, IgE. Now, your antibodies are a critical element. They all, once again, come from your B cells. When those B cells come out too early, because your innate immune system isn't functioning well, they are now coming from a part of the body called the extrafollicular cells. In that, they should be coming from your germinal cells and your lymph nodes. Not trying to get too techie, but they're coming out. They're not fully matured. And when they're not fully matured, they're very susceptible to attacking parts of your body because they haven't gone through their full training centers. And that's one of the problems when your immune system is unleveled or not balanced. So let me give you the basics, the basis to have a balance in your immune system. Are you guys ready for this? Vitamin A, vitamin C, vitamin D, zinc, and omega-3 fatty acids. We call them pleiotropic because they work through different pathways. They work both for the innate and the adaptive immune system. I'll say that again: vitamin A, vitamin C, vitamin D, zinc, and omega-3 fatty acids. One of the most basic things. So a multivitamin, multimineral with the fish oil is basically the starting point. It's the anchor in which you start with to enable yourself to balance your immune system. Could you add some iron? Could you add some magnesium to it? Without question. Could you add vitamin E? Yes. So all I'm telling you to balance your immune system, and this is not a full immune system protocol, this is the basis for starting. It would be a multivitamin, multimineral, and omega-3 fatty acid. Interesting. So I've got some people asking some questions. Facebook user: too many companies offer window dressing. Yes, agreed. Too many companies offer window dressing. They're not there. They're not sharing what they need to share with you. It sounds good, but more so than it's sounding good, it really needs to be good. Again, if you're interested in companies that I use, that I would give my thumbs up to, that I use for my friends, my family, my patients, and myself, I'm happy to share that with you. Dennis is here in Canada. Supplements are regulated. Yes, they are regulated more than they are in the United States. The aim of the legislation is to ensure that supplements are safe to use and that they're manufactured in a clean and safe manner. Yes, Health Canada is a little bit more stringent than America. Facebook user: putting many ingredients but insufficient amounts to make a difference. So I see he broke up his statement, and that is correct. It may be the right ingredient. It may even be the right quality of the ingredient, but it may not be the right amount, which goes back to what I said before. The company, the reputation, the quality of the ingredient, if it's truly there, the right dosage, and the right formulation for what you need. So if you have any questions, please feel to reach out. Love you to share this very brief live podcast with everybody. We're trying to keep them nice and short. Hope everybody's staying healthy. Dr. Rob, always yours now.